So every once in a while, there comes a new landmark product that changes the landscape of our practice. And I want to talk about one of those that has just come out. Research, a lot of it comes from the Netherlands, as you know, my home country. In fact, Rotterdam, where I grew up. And there's been a few frustrating things that have happened with our gut patients. And that is this. We can give them the very best probiotics, and you know how big we are in probiotics and have been for decades, even before it was popular. And it creates change, but there's a select few people that the intestinal environment is just barren. It's like the Sahara Desert. It can't support growth. And that is a problem, because then you're just supporting, but you're not really gaining. Does that make sense? And supporting is better than going backwards. I know that, so it's still very useful for them to take these probiotics, but can we do better? And so the Dutch went to town as far as research. Why is this happening? And they built on some research coming first from England, that showed that if you re-nourish the mucosal membrane with some very powerful things such as zinc, gluconate, a certain type of vitamin A, we are starting to get more successful. But the one thing was missing. So they had an aha moment, and they thought, you know, we know the first 3 days of breast milk has compounds on it that just turns on the immune system of the gut, just turns the lights on, allowing the gut to start supporting bacteria. It's colonization, because we're born with a sterile gut. So how about if we look at that again? And they came up with the active compound. It's called 2FL, fucolactosaccharide. And 2FL is a compound that is part of colostrum. So they started doing research with that, plus a good basic protein made out of rice and pea with branched chain amino acids, making it very hypoallergenic, prebiotics, and nutrients to restore gut integrity, so it gets rid of leaky gut syndrome, and also to re-nourish, because these patients have gotten deficiencies, especially certain B vitamins. So re-nourishing, fixing, and providing an environment for the new bacteria to come back. And wouldn't you know it, 6-week clinical studies show a 19-fold increase in gut bacteria colonization of a very important bug called bifidus, lactobifidus. There's others also. This one showed 8 times, and that one, but it's just absolutely astounding what this does for patients. So finally, we have a tool to turn around chronic gut situations that can go anything from Crohn's, ulcerative colitis, irritable bowel syndrome. It goes on and on, all these gut conditions. It's called Ultra GI Replenish. Yeah, this one. I've been using it myself as a snack. I think it's absolutely delicious. It's not too sweet. It's got a lot of protein in it. It can be used as a snack, as a meal. And so good compliance, because it tastes good. It's not grainy. And that's what I'm doing. I'm pretty excited about this one, as you can tell. So, new tool to use. Yes, the doctors and their toys. So, yeah, you have a question?
Is that something that jumpstarts the process, and then you can just continue it and just do probiotics?
Yes, it totally jumpstarts the process.
So it's not a long term?
It's not a long term. It can be as short as 6 weeks, or it can be as long as a year. Because some patients are so damaged, there's so much malnourishment. So with celiac patients, studies have shown that even after you discontinue gluten, 10 years later, the damage has continued, and there's even more nutritional deficiencies than 10 years ago. Those people are going to need a little more than 6 weeks, as you can imagine. But if you come in with just your basic complaints, I've had too many antibiotics, there's a gut disturbance, things are just not happening, 6 weeks would be more than enough.
Does it have any bearing on someone's need for that kind of thing down the road, whether or not they were breastfed?
Yes. If you have a history of not being breastfed, I would definitely recommend getting that fresh start. It's never too late. It's never too late. Yeah? And that's part of the reason I'm doing it, because I was never breastfed. So, aha, here's my chance. Yeah?
Is that metagenics?
That is metagenics, yeah. Yeah, they've taken the research from the Netherlands and they've gotten permission to run with it. Yeah, yeah. And they have a working agreement with a lot of the most powerful universities in the world, including Erasmus University in Rotterdam, Harvard. Yeah. It's not what you know, it's who you know. Good. All right. So we have an exciting topic tonight. Concussion discussion. Might seem a little remote to some, but concussions are so common. We see them every week in this clinic, and it's so important to know what to do. Dr. Stacy's going to go into statistics, what it means, what kind of damage it does. I want to tell you a little bit about a personal experience, just as a lead into this topic. As some of you know, I am pretty huge into cycling. I love anything related to cycling. And I was, a few years ago, just going down this fairly steep hill on the road. And just in full tuck and just on my little meter on my handlebars, it was reading, it's one of the last things I remember, 37 miles an hour. And I remember my front wheel hitting this rut, you know, our wonderful Michigan roads. My front wheel came to an abrupt stop. I did not. So it catapulted me up in the air. Later on, I figured I flew about 30 feet through the air and landed on my head at 37 miles an hour. Yeah? Well, by then I probably decelerated somewhat. I remember a loud sound, and that's the last thing I remember, and then waking up on a sidewalk far from the road. I have no idea how long I'd passed out. And I first started moving around and made sure nothing was broken and I could indeed stand. And I knew where I was and saw my bike in pieces next to me. It had literally broken in half. Was very aware of this very intense headache. So took my helmet off, and then I immediately noticed it had cracked in many different pieces. There's 3 breaks through the entire compound where it had absorbed the shock. I can just separate out the helmet where it's just cracked through where I landed. So obviously I landed on the back of my head somehow. Yeah, cracked this thing all open and into pieces. And if it weren't for this, I wouldn't be standing here today. It's a guarantee. Yeah, it's a guarantee I'd be dead. So this is a bit of a promotion for helmets. Yeah, it's a simple thing. And if you're going to be doing anything that involves any kind of speed, you got to do this. If you know there's going to be a risk of impacts, you got to do this. It's just the way it is. I got home where I took a lift. Something about blood all over makes people help you. And I walked in very aware that I had a severe concussion. And I thought, okay, it's Friday night. I have patients on Monday. It's the first thing I thought. How do I get through this? Well, I guess it's time to be a physician now. And had this severe pounding headache. And the first thing I did was reach into my homeopathy cabinet, which is, as you know, a European form of medicine, and took one for nerve damage called hypericum and arnica, which is the other one for trauma. And it was the most amazing thing that I've ever experienced with homeopathy. And I've seen amazing things. One of which is my daughter says, Dad, look, and she's got poison ivy from our hike just the past week. And I gave her some homeopathic remedy called Rhus toxicodendron, or Rhus tox for short. And I checked on it yesterday and it's almost gone 3 days later, right? Amazing how fast that works. That's wonderful. And that's what I expect. But I didn't expect this with the arnica and hypericum, because I took it and literally within seconds, I heard this weird sound in my head go whoop, just like that. And my headache was gone. It was just gone. So it went from an intense splitting, can't even think headache to just being gone. And I could be lucid and go about what I had to do. And I put the nutritional protocol in place. Dr. Stacy's gonna talk about that right away. And the worst of it was that I Didn't let myself drive for a week because all that stuff going by would just create headaches. It was just too much. Didn't watch TV or read. I just took care of my patients. Hopefully I wasn't blabbing silly things. I wasn't. And you could just go on. So knowing the right protocol, first of all, prevention, and then knowing the right protocol, which we're going to talk about, is a critical deal and can help prevent a life of misery, because Dr. Stacy and Dr. Kate and I have seen plenty and plenty of closed head injuries, concussion-like injuries that have had permanent effects. We have seen so many of them because they never were dealt with properly. And folks, the brain drives us. It drives health. We think of the brain as emotions and thinking and memory and all those things. And yes, yes, yes. But when the brain is damaged in any degree, it's also sending damaged signals down the spinal column, and it's affecting the signals to your liver, to your stomach, to your sex organs, to your legs. And that garbled message can then cause disease. Right? Things aren't right here, so things are not going to be right here, and it will cause all kinds of issues there as well. So do not underestimate concussions. This is a critical discussion, and Dr. Stacy is going to get it.
Most of us have probably had some sort of concussion. I don't think I've met many people who haven't undergone any type of concussion whatsoever. I have a lot of misconceptions where people say, well, we were knocked out. I'm not really sure if I had a concussion. If you're knocked out, you had a concussion. There's always something going on there that is going to affect the brain. So tonight, we're going to go through a little bit of an anatomy of the brain and the concussion. So concussion basically stands for shake violently. Traumatic brain injury is what you'll hear a lot within the medical world. They won't actually call it a concussion, they'll call it a TBI, or traumatic brain injury, which is usually a functional injury. And basically what happens is, think that the most important structures within your body are encased in bone. Brain is being one of them, the spinal cord being the other. So if your brain is that important, it's also the softest tissue within the body. So when it's encased in its bone, in its skull, when you have a head injury where you go forward or back or you hit your head on the side or anything like that, the brain does move within that area. Now, if it moves to the point where you cause depolarization of some potassium cells, then you're going to set off a cascade of event which is inflammatory, right? Your microglial cells, which are basically your immune modulator cells within the brain, they will set off an inflammatory reaction which increases your reactive oxygen species, and it also increases your nitric oxide, which are both inflammatory to the brain. Now when this type of thing happens as well, a neurotransmitter called glutamate, which is excitatory, ramps up. Basically what that's doing by creating excitement within the brain, it's driving glucose to the brain. The brain needs that glucose to function because the injury has happened. We need more ATP. ATP needs to help us work. If those things aren't available, that's when you either get knocked out, pass out, or you start to get the headaches and other things. So many of these things also come from nutritional depletions, which could also prevent the amount of brain trauma that you undergo. So anytime you have a side-to-side or a front-to-back movement within the brain, there is some damage. Think about boxers. Muhammad Ali is probably one of the best ones that most people think about, right? He was diagnosed with Parkinson's. Now, they believe that his Parkinson's injuries were due to the multiple hits to the head. That can definitely be part of it. Now, as I was reading through some of the research, I brought up some facts for you. They do believe that there is very similarities when you're looking at imaging within the brain after a concussion or a TBI that are similar to what looks like Alzheimer's disease. So you get microfibril tangle changes within that brain. So there's a good possibility that could lead to changes later in life, depending on the type of amount of hits that you take. So with concussions, we're going to call them concussions or TBIs. 80 to 90% of these recover within 7 to 10 days. The other 10 to 20% are where we have the post-concussive syndrome. Those can take up to 25 to 75 days and most of the literature to recover. That's a long time when you're thinking about it. 5 to 10% have symptoms that persist beyond 6 weeks. In 2010, and that's the most recent research that I could find, even with this whole football thing with the helmets and concussions and everything they're talking about, the most recent research says about 2.5 million occur every year. 4 in 100 in football alone, and I feel like that's probably a little low. I don't think we're catching all of those. 138 die every day in the US from injuries that include a TBI. Now, usually if you're going to die from a traumatic brain injury or concussion, there's something else that's happened within the head, okay? I also brought out, I'm an equestrian, so this is kind of straight to my heart here. Horseback riding is the 8th leading cause of emergency room visits in females, because that is primarily a female sport. The rate of the overall injury is low compared to other sports, but we have a lot of traumatic brain injuries because what happens? Only about 4% of riders wear helmets. And that's pretty sad when it comes down to it, because you're usually riding an animal that's going over 40 miles an hour. And if you get tossed, it's very similar to Dr. Denbour's bike story. And you're much higher, and it's much more traumatic when you hit. It's a very hard fall. So the risk of the severe injury is higher than in the other sports. And helmets actually are associated with a 5 times decrease in head injuries from the people who are wearing them alone. 5 times. That's a lot of protection in a very small amount. Now, this also falls, was kind of interesting as I was looking on my Facebook feed today. This is actually Helmet Awareness Week in the equestrian world. So I'm like, wow, look at that, falling right on the right time. So most people know about the symptoms that go with concussions, right? We all know that there's going to be some headaches. There's probably going to be some nausea, dizziness. People can move clumsily. You'll get mood changes, right? These are things that people observe from other people. Of course, loss of consciousness is a very big one. Reported is what people will tell you afterwards, or they have headache or pressure in their head. Pressure could be anywhere within the head. It could be frontal. It could be exactly where the hit was taken. It could be in front of where the hit was taken. Nausea or vomiting, confusion or memory issues, bothered by light and noise, or blurred vision. Now, the bothered by the light and noise is kind of a big one because most people do not actually ask about that or pay attention to that. A lot of these are also exacerbated by movement or physical exercise. Danger sounds. These are probably the most important. This is when we need to go in and get emergency room help, okay? If you have one pupil that's larger than the other, this is not something that a lot of people take into account. They don't look straight into the eyes anymore. This is really big for the teens as well, because you don't get to see a lot of teens face on anymore. But look at the pupils. If one is larger than the other, that's a surefire sign. You got some CNS injuries, so central nervous system injury. Drowsiness or inability to wake up. That's why immediately after somebody's had a head injury, they will tell you we want to keep them awake for at least 8 to 12 hours. Because you want to make sure that there's nothing going on that's going to affect the brain. Because if you can't wake somebody up, it's really hard to bring that brain back around. Headache that gets worse or does not go away. Especially if it gets worse, that does not go away, happens with a lot of head injuries. Let's be honest, that's part of what happens within a head injury. Most people that get in a car accident, they'll say, oh, I still have a headache. Some of that is inflammation from where the hit happened as well. Slurred speech, weakness, numbness, or decreased coordination. So there's a lot of times that we as doctors will come in and have patients do coordination tests. We'll have them have their arms out and we'll have them touch their nose and go as fast as they can and keep touching their nose. We'll have them tap their hands on their legs and go as fast as they can to see if there's any injuries per side. Repeated nausea or vomiting. Convulsions or seizures, those are definitely big signs. Most people will know, oh my gosh, I got to get somebody in. But the vomiting or nausea isn't something that most people would think about with those. Any unusual behavior, increased confusion, restlessness, or agitation. The unusual behavior, another good one here, is they can't complete a sentence, or they're switching words around within a sentence, still saying what they want to, but switching words. Loss of consciousness, obviously. Those should be taken seriously. Now, I actually pulled up something for everybody to see, because most people don't understand the whole pupil thing. So the pupils are the black part of the eye. Okay? When you shine light, so this is a normal pupil reflex here, which is this nice little guy here. So when you shine light in his right eye, the other pupil should actually look the same, right? So they should both equal. So if you're in a dark room, they should be big. You shine the light in, they'll constrict, and both of them will constrict down at the same time, okay? So now say you were to shine a light in his eye and it constricts and the other one gets large, that's a cranial nerve 3 lesion, okay? If you shine a light in that eye and it doesn't restrict at all, that's a cranial nerve 2 lesion. So one's an optic lesion, that's 2. Okay, so this one's always big. Most people have, you know, if you've paid attention to the news within the last 6 months, primarily they've been talking a lot about the football because football season did just start. And they're talking about the concussion and how they're worried about what to do with your football players. So football, the helmet is mainly there to protect the skull and absorb the direct linear force impact. So linear force is straight on, right? You can have rotational forces as well. Your head can be turned, you could be hit, and you rotate as well. So most of the studies on the helmets are for a linear force impact, okay? 67,000, and I think this is low, is diagnosing concussions in high school football every year. I think if we actually paid attention, there's probably a lot more that are going on. We just aren't asking the right questions or paying attention to where we need to be. Now, with your football helmets, let's talk a little bit about that. So the football helmets, Virginia Tech does a bunch of studies on helmets. They're supposedly what the standard goes by. So there's about 5 to 7 different companies that have 5-star ratings. 5 stars, obviously the best. Rydell is probably the most known because that is the one that most of your professional football players wear. There's also Zenith helmets, and Zenith helmets tend to be more of what you're going to see in the high school and lower football. Now the reason why some of the Rydells are being worn more often, they have sensors within that helmet. And that sensor will go off if they take a hit that's more than 80 pounds of force. And if that goes off, then that's their cue to bring that player out to check him. Now there's a bunch of, if you look at the different research, they're not really sure how much force is going to cause a concussion. Well, honestly, because we don't know. It's going to depend on the person too. And it's going to depend on where the linear force or rotational force hits. So that's always interesting. Now, the old football helmets. Who remembers back in the day where the football helmet, the chin strap actually attached to the outside of the helmet, right? So what that did is basically that doesn't do anything except give us protection from a hit from the outside, right? Now, when the football helmet, and if you notice his is also protected hit from the inside, right? Most of your helmets need to have that protection from the inside, and the chin strap should attach to the inside because the outer shell is mainly to take the hit. The inner shell is to move with the head. So as the head falls back into it, you have more pressure that pushes within that helmet. So, and that's also, there are different sensors in all of those helmets. Really, the Rydells are the only ones that have the high sophisticated where you can actually check what the hit is. But Zenith are mostly what are used by your kids nowadays. Now, and the other question is, and I don't know if I have it up, yep, I have that in there, is when to replace. And we'll talk about that in here a little bit. But with football, they do recommend that you check these every year. How many kids do you think have actually sent their helmet in to get checked every year to make sure it's still functional? Yeah, slim to none. And it's probably in your college, the helmet goes in because I think that's a requirement through those schools. So. Very interesting though. So helmets these are a wide variety and it's really going to depend on what you find. Now Zenith did just have a recall of one of their youth helmets, so if you know of anybody that carries a Zenith helmet, you need to have them check to see if it got a recall. But I believe, I think it's Zenith is actually made here in Detroit, in Michigan. Rydell is not. So, support local. So equestrians. Now, 45% of these experience a concussion with a fall. I'm going to tell you this number is very low. Because when you talk to an equestrian, they really don't know what concussion is. They don't know what the symptoms are. They don't know any of that. So they're not really well versed in that. Because you're going to find anybody from professional to somebody who just starts out riding. Not everybody's going to have an idea. Most of your professionals are probably the ones that are telling you, okay, this is what I've experienced from my fall. Okay? Head injuries account for 60% of the deaths in the equestrian accidents. And that's very true. If you're going to fall off and you hit your head and it's not covered, usually it's going to take you out. If not, there's going to be other spinal complaints. Okay? Christopher Reeve's another great example here. Okay? The equestrian helmets are much different. When you look at those compared to any of your football, your motorcycle helmets, anything like that, our equestrian helmets do clip on the outside. So ours are really only there to support the actual foam around there. So if we take a hit, you're just protecting the foam. But as with equestrian helmets, one hit and done is what they say. You have to get a new helmet. You can send it back in to get it checked in, but usually the integrity is lost, so you need a new helmet. Okay? Motorcycles. Here's something very, very interesting. Now remember we took out the helmet rule, right? Okay? So in the accident, say you get in an accident and you have in a motorcycle, hospital visits have rose 4-fold since we took out this helmet law. Okay? 10% of those died compared to 3% that were wearing the helmet. I think I'd probably put back on my helmet. Yeah, you're going to get road rash, you're going to have a bunch of other things that are probably going to be painful, but you know what? So you have some scaly skin for the rest of your life. Once that head gets an injury, a lot of times it's permanent, especially at the 70, 80 miles an hour. Most of those within crashes that they actually have, those that died at the crash scene rose from 10% to 68%. A little bit more important to wear the helmet. So, very important. Motorcycle as well, they also have their own standards where you can actually turn in your helmet. They do say if you have a crash with a motorcycle helmet, it's done, get a new one, okay? Just more of the safety than anything, because your integrity is meant to only take one hit, and those hits are usually pretty hard. Now, if you drop it off your bike and onto the ground, they say that that's not a big deal, okay? Bicycles. Bicycles, obviously, as we were talking, there's 86,000 head injuries in 2009 that were reported. 86,000. And that's because there's a lot more people on their bikes, right? You get a lot more people getting out, they're going on their bikes, they're going on trails, they're riding on the roads. So you have a lot more injuries because of things like poor pavement. 90% of the bicycles killed in 2009 were not wearing helmets. Kind of important. Most of us, actually all of us, grew up in the non-helmet wearing eras. So we didn't really realize how important all of this was into our health. Now that we're seeing this is just a small amount of prevention. This does not guarantee you're not going to get a concussion. It's more preventing the other problems, where you're going to fracture your skull. You may get a subdural hematoma. You may get bleeding, hemorrhaging in the brain. That's in hopes that this helmet is going to prevent that. It's not always going to prevent a concussion, because a concussion is just movement of the brain in the skull. And it depends about the movement within the brain that's going to affect you. So, replacements, we talked a little bit about this. Most of them have within the manufacturer will actually walk you through how to get them checked out and when to replace. Football, lacrosse, hockey. I didn't put rugby in because that's not as common here in America, but rugby is also another one. The NOCSAE, actually, if you look that up, has specifics on what should be done, where to send the helmets and all that. So that's really important, and that's really what the school should have available. Like if your schools actually provide helmets, they should be getting those sent in every year to get them checked out. So they recommend them reconditioned every year to make sure that they're still up to par. If they're not, then that's when they will recommend getting a new helmet. So that does make a difference. Now the nice thing about the new football helmets, we'll go back to those a little bit. The new football helmets also have a better ability to be fitted to the head correctly. They, especially with the Rydell's, they have an air pump system that pumps up basically around the base of the skull and over the ears, so that it's a better fit, so that it forms to the head more. So if you do take a hit, then it will lock back and forth a little bit easier. And my question, which I had posed to Dr. Denbour, is, so what happens if you take a hit? Do those air pustules break? And I did some research. No, it has to take so many hits per time before they actually break. So very, very interesting as I was looking through. But really the football helmets are where you're going to find most of your research on, just because of the concussion debate that's been going on with the football players for so long. And what do we do about it? So big things, okay? We all know how to, most of us really know what are the signs and symptoms of a concussion. What do we need to do? Where do we need to go? Go to the doctor, get checked out, right? So there's some different studies produced on supplementation. Now, a lot of these will tell you we need more studies to find out. But within that brain cascade that we talked about, one of the things that actually decreases for up to 4 days after concussion is magnesium. Magnesium is the 4th most abundant nutrient in the body, also the most commonly deficient nutrient that we have. So if you're already magnesium deficient and you take a hit to the head and your magnesium depletes even more, your brain injury is going to last longer. So this is a very good ounce of prevention more than just a cure. So usually we recommend about 400 milligrams for an average size adult. If you're more than 200 pounds, obviously 100 milligrams more. If you're under 100 pounds, 100 to 200 milligrams less. But this is something that even with my kiddos, I'll tell them, I want you to crush this up, get that in a smoothie. You're in a contact sport, you need to have this, okay? The other thing I should bring up before I jump too far, mouth guards. There's a lot of research that says mouth guards can help to prevent the direct impact and the trauma within the concussion. So then you don't have the slamming of the jaw, which then throws off the TMJ, which is going to hit your occipital muscle, which is then going to hit your frontal and your temporal muscles, and that's going to change things within the body as well. So important things, sorry. So magnesium, very, very important. Now this can be found, yes, in different nutrients. Most of your multivitamins are going to contain magnesium, but remember most of your magnesium, even in the natural supplements, are only meant to meet what the daily needs are. If you're already deficient, the multivitamin is not going to get you there. So some symptoms that people like to know with magnesium deficiency, if somebody scares easy, like if they startle easy, you walk up behind them and they startle easily, it's likely a magnesium deficiency. Headaches usually have a magnesium component with those. Excessive thirst, a lot of times, will be a magnesium deficiency. Blood sugar imbalances, magnesium. Magnesium works within the entire amount of the body. Magnesium and calcium balance each other out, right? So those that drink a lot of pop, a lot of phosphorus, you're drawing calcium out, so the body will try to draw with more magnesium, and then you lose bone. Does that make sense? So, DHA and EPA. The reason why, usually this is EPA, DHA, but the reason why I put DHA first, because DHA is the primary nutrient study, the omega-3 fatty acids that are studied for the brain. This is what helps to drive brain function. So when we have little ones come in with cognitive dysfunction, or they're just not learning, they have some ADD, cognitive disorders when they're younger, we'll do a lot of DHA with them because the brain is still learning. So I'll do a lot of times, we'll add in the Omegagenics DHA. You can use Max EPA DHA because it does have DHA in it. But this is something, if I have a post-concussion come into my office, I'm going to do more DHA than EPA because I know I need to stimulate the brain. Okay? Zinc. Why do you think zinc would be up here? Anybody have an idea? It's an immune system support. So when you have microglial cells that set off this inflammatory cascade because they're immune modulators within the brain, zinc is required to calm that down. So, and that's the other thing that we see a lot, is we'll see a lot of zinc deficient patients as well. So zinc is very, very important to keep the immune system working and also the brain functioning. It also helps with the thyroid, which we don't think about, that's metabolism. So if you need to rush some glucose to the brain, your thyroid has to pick up to try to drive those cells going. Do you see how this is just not a brain thing? Everything is working in concert to try to get things to the brain to help support this. This also will help to repair that blood-brain barrier that gets leaky right after an injury. Okay? I'm going to jump down and skip acetylcholine here for just a second and go to our vitamins A, C, and D. Vitamin A and E actually have a lot of studies together where they can help be neuroprotective for the brain. So if you're taking vitamin A, most people have A and E in their multiple vitamin. If you're taking those, you have a good quality multiple vitamin, A and E can be neuroprotective. If we've had an injury, we'll often increase the vitamin A. Vitamin A also helps to support the immune system, so it's an immune modulator, so it'll help to bring that inflammation down within the brain. Vitamin C has very similar things. It's an antioxidant, correct? Vitamin C, when we are stressed, we blow through vitamin C because the body is trying to help deal with whatever inflammatory component is going on, whether it's viral, bacterial, microbial. Those kind of things vitamin C works well with, but it also works with inflammation within the brain. because it does make it through the blood-brain barrier. What you're trying to do is use anything that gets through the blood-brain barrier. Now, there's a lot of things that as you look through research and you go, okay, what do they do post concussion and TBIs? One of the big things that I didn't say, don't ever use aspirin after concussion. Do not use aspirin. Correct, because it can cause bleeding. Very, very important. And a lot of people, the first thing they want to jump to is an anti-inflammatory. Let's use an NSAID. Aspirin's not the one to go to. Okay? So, and that's where a lot of times the Hypericum, the Arnica, those are great for post because that's something that will take the inflammation down naturally. Okay? Vitamin D. Vitamin D is basically, they should be called a steroid hormone. Even though it's a vitamin, there's not a cell in the body that doesn't have a vitamin D receptor. And where do we live? We live in Michigan. Very common for us to be vitamin D deficient. If you're already vitamin D deficient, it's very hard to repair. Vitamin D is necessary for repair. If you're vitamin D deficient, the brain is also vitamin D deficient. And that takes a while for that vitamin D to get across the blood-brain barrier to work its way through. So remember how we talked a little bit about how in some of the models they're seeing that concussions are starting to look like Alzheimer's disease. They have some very similar pictures. This is where acetylcholine comes in. The body needs choline to help to build the neurotransmitter acetylcholine. Okay? So acetylcholine is good for memory function, focus, right? I can remember things. So when you have somebody with a traumatic brain injury, one of the things they'll complain about is focus and their cognition. I can't remember anything. I'm still working on that, right? So this is a great thing. When you hit that hit and those microglial cells come off, what happens is you get depolarization of axons and neurons and you get some stretching within there. And sometimes you're creating some inflammation of scar tissue within the section of the brain where the hit took, right? So if you help with acetylcholine, you can actually help to increase the healing of that and stop the long-term damage. Yes, this can be used post-concussion. This can be used years later because you can still help to support this. Now, the acetylcholine that we use in the office is called Cereva. And this is technically isn't acetylcholine. It's huperzine A because huperzine A is studied to help build acetylcholine within the brain. Now, the huperzine A also has studies on Alzheimer's. It can help break down those neurofibril tangles within the brain for Alzheimer's. So what we're trying to do is catch it early and repairing it post-concussion. So you can do this many years later and still see benefit from it. Very, very important. Things that we don't really think about.
Is that a precursor to acetylcholine?
Mm-hmm. Helps to build it in the brain. Yep. As is zinc. Zinc can be a precursor as well. The one thing that I haven't touched on is your B vitamins. B vitamins are always very, very important when you're dealing with that because what helps to build your neurotransmitters? One of them is B6, the other one's B12, folic acid. Those are all things that need to be in there. Nicotinamide is another thing that they discuss as well. So these are all important. These are where I found most of the research of what can you use, what happens within the brain, where do we need to go. And that's why I chose, in the order that I did, these seem to be the most commonly studied. Okay? So as you look through, I have a bunch of references at the end. There are many of these that actually talk about what dosages you need, things like that. So ideally, zinc, this is one of the reasons we do zinc tallies in this office to see if people can taste zinc. If you can't taste the zinc, you're usually low in zinc, so that's a good quality indicator of where's your health status at. So I also wanted to give you guys some things to do at home because this is probably one of the most frustrating things that I run into with patients because especially if they're kids, parents have no idea. Like, what do I do? I mean, I know I need to bring them to the doctor. I know I'm supposed to look for a headache. I know I'm supposed to keep them awake. I'm watch them for nausea. What else do you do? Well, there's some really great information out online. So there's this King Derrick testing, or Devick testing. The Huffington Post actually came out with some of this information back in March of 2005. So this is basically what this is a test that you can actually have at home or you can do on the sidelines. And this is something that should be done pre-season as well because you want to have a baseline for it. So basically what it is, it's an eye tracking test. They used to use this for dyslexia, okay? So as you see here, Everybody see the lines? The numbers are probably going to be harder unless I walk up real close to you. Okay, so you can see the lines, right? So this is the demonstration card. So you basically tell the patient, okay, so what I want you to do is when you start reading these, you're going to read them across until you get to the very bottom. During that time, I'm going to time you with a stopwatch. Okay, when you're done, I'm going to click the stopwatch off. Now, normally your examiner will have a scorecard with all these and they mark off which ones they get wrong. Okay, so they got the demonstration card, right? We're going to go to the first part. So notice the first part has lines. This is wonderful, right? So they start, you click the stopwatch, they go all the way across, you check off anything that they got wrong, stop, and they hit the bottom, right? Then they move, and they have to do all 3 tests right away, okay? Then you get to move to same size without lines, okay? They start again, you hit the stopwatch, they start reading until they get to the end, click the stopwatch, check to see if there's anything off. The last one gets even more tighter, no lines, right? Same thing. So ideally pre-season, what you're looking for is if you sustain any type of brain injury, because the eyes are very important when it comes to the brain injury, because the optic nerve comes back from the eyes, hits a chiasm, and sits right in the middle of the brain back here. Any movement of that is going to change how the eyes work, right? So if you're 3 to 4 seconds off, you've experienced some sort of brain injury. So it's a really easy test to do all the time at home. But you definitely want a pre-season one. Now they do say the younger generation, because obviously their brain is still growing all the time, should get better at these tests as the year goes on. If they sustain a brain injury, they will get worse. Okay? So I thought that was kind of a nice test to have at home. Now the other one is the sideline concussion assessment test. They have a version 2 that just came out. And this is basically something you can get offline. I got both of these offline, very, very simple to find. So basically they talk about the risk factors. So most of these are things that you would have already filled out beforehand anyway. Have you ever had a concussion? Bell rung is what they call it. Or injury, how many, what symptoms did you have, loss of consciousness, were you hospitalized, any of that. Any other family history, blah, blah, blah. And then how do you feel currently? What do you have? Do you have any headache, nausea, neck pain, drowsiness, balance, dizziness, fatigue, confusion, and it kind of goes on from there. So, and you can also select any things for cervical spine trauma, because let's be honest, there's usually some cervical spine trauma. Especially in the younger generation, they're more likely to have a more traumatic brain injury because they don't have the strength within the neck. So when they go back and come forward, there's going to also take some strain within the neck, but the head is not as supported. So you're going to see that more often in the younger groups. Also, it just basically kind of goes through what's your orientation, what's your concentration. They have you do word recall within this test as well. And they recite numbers, like they'll give you 493 and tell me those backwards. And they go all the way up to 7 numbers on that. So that kind of gives you an idea of what the scoring system is, and whether or not how high and how low you score will depend on whether or not you've experienced some sort of injury. So little things that are great to do that you just don't realize that you have at your hands and fingertips. Some of the actual coaches in college and things will actually carry this King Devitt test on the sidelines. If they see one of their players take a hit, they'll immediately bring them off and have them go over it. So that they can see, what am I looking at? Do I need to take you out for a while? Where do we need to go? Okay? And also remember the pupil reflex. This pupil reflex is so important. We don't think about the eyes as being a direct result of what's happening within the brain, but if you can actually do this pupil reflex and you can see that one eye is not moving or they're equal, usually an equal reactive is what we call it, pupil, the brain is doing okay. You could still have some coordination issues, which still means, okay, we're off in either the cerebellum, memory issues, those kind of things, but that at least means, okay, the brain didn't sustain a ton of injury, so the eyes are doing well. Now let's focus on the rest of the things that we need to deal with, whether or not that's a magnesium deficiency, you need some oils for the brain, that kind of stuff, okay? So I've put on a ton of references here, and if you guys want them, I'm more than happy to print them off for you. A lot of these have to deal with most of your studies within brain injury comes from rat discussion first, obviously, and then it goes into supplements and anything like that. But I have a couple pages for you that you can look through. This Prevacus/concussions, that really actually down here, this is the last one. There's a lot of statistics within concussions. And this is one of the underthought of things that go on in our world, especially when you have sports, any sports related. Most people don't think of this with bikes, even soccer. I didn't touch on soccer very much, but soccer, think about that. They do a lot of linear force, right? And that linear force, there's always that big question. Do we need to take this out of the younger kids until they learn to do this correctly? What do we need to do? How does that happen? Because I would say most of the common concussions I see come in are actually soccer related.
And they never wear helmets.
No, they do have headbands, don't they?
Yeah, they're found to be fairly ineffective. And,
Yeah.
Startling statistics on professional soccer players, by the time they retire, they've lost 10% of their IQ on average.
Yeah.
So, kind of nasty.
Yeah, so, and we don't think about that long term because, everybody's, my biggest thing when I have young ones come in, they always want to get to the next game. I want to play the next game. And they forget about, because we're older, we've realized, okay, but you're really not going to be happy 10 years from now if you continue doing this. The damage that you're sustaining now can be changed if you allow some rest to happen and healing to happen. But kids don't think about that. So it's one of the things that we as doctors try to push for them. No, you need to have this downtime. You don't need to be at that next game. There'll always be another game, I guarantee it. And it doesn't always necessarily mean that you're going to make it to the next spot. Okay? Any questions?